Hello Maricos, welcome back to my channel. So in this video, we are going to cover the femoral sheath and the femoral canal and their clinical correlations. In the previous video, we have talked about the femoral triangle where we have discussed the boundaries, contents and its clinical correlations. I hope you understood. Now, what is femoral sheath? So femoral sheath is a funnel shaped sleeve. Okay, coming to the definition, it is a funnel shaped sleeve which surrounds the femoral artery, vein and deep inguinal lymph nodes. And also the femoral branch of the genitofemoral nerve, and also femoral branch of genitofemoral nerve. Its length is about 3 to 4 centimeter. Okay. Its length is about 3 to 4 centimeter. Okay, keep this in mind. Its length is about 3 to 4 centimeter. Okay, so coming to the extent of this femoral sheath, the upper end is inguinal ligament, and the lower end is the middle of the thigh. Okay, middle of the thigh. Next, coming to its formation. How is it formed? And what forms the walls of the femoral sheath? How is it formed? See, anteriorly, this part. Anteriorly, it is the modification of the fascia transversalis of the which is the fascia of the abdomen. Okay, which is the deep fascia of the abdomen, of the fascia transversalis. Okay, and this one behind, it is the modification of the iliac fascia. Do you know what is the iliac fascia? This is the fascia which just covers the iliacus muscle. Okay, so whilst anteriorly it is formed by fascia transversalis, and posteriorly is formed by the iliac fascia. Then okay, now this femoral sheath has 3 compartments: the lateral compartment, intermediate and the medial compartment. The contents of the lateral most compartment are this one: femoral artery, then femoral branch of the genitofemoral nerve, Okay, the lateral compartment contains femoral artery and the femoral branch of the genitofemoral nerve. Then the intermediate compartment includes femoral vein. And this, now it's an important part, the medial compartment, which is also known as the femoral canal. Okay, femoral canal. This includes a lymph node, which is known as lymph node of Clockwood. Okay, lymph node of Clockwood. So coming back to this lateral compartment, what are the contents of the lateral compartment? It has femoral artery and femoral branch of genitofemoral nerve. An intermediate compartment has femoral vein, and the medial compartment has lymph node of Clockwood. We are done with this femoral sheath. Now we are heading to the medial compartment, which is also known as the femoral canal. Okay, so the femoral canal, coming to its definition, it is the medial compartment. It is the medial compartment of the femoral sheath. Of the femoral sheath. And you can see its shape is conical. Okay, conical in shape. Okay, its length is about 1 to 1.5 centimeter, and the length of the femoral sheath was 3 to 4 centimeter in length. But the femoral canal, which is usually shorter than the femoral sheath, its length is about 1 to 1.5 centimeter. Okay, okay, so now see, this is the opening of the femoral canal. Okay, it's the opening, and this opening is also known as the femoral ring. Okay, so what is the upper end of the femoral canal known as? It is known as femoral ring. Okay, now coming to the boundaries of this femoral ring, it has a medial boundary, it has a lateral boundary, it has an anterior and a posterior boundary. Okay, medially there is presence of this, there is a ligament. Medially there is presence of a ligament. This is known as lacunar ligament. Medially it has a lacunar ligament. Then laterally we have this fascia, which lies between the intermediate compartment and the medial compartment. Okay, laterally we have this fascia between intermediate and medial compartment, and laterally it also includes this femoral vein. Okay, and femoral vein. Okay, anteriorly and post. Now coming to anterior and posterior, this one, boundaries. Okay, anteriorly it has inguinal ligament. Anteriorly it has inguinal ligament, and posteriorly it has pectineal ligament. Pectineal ligament. Pectineal ligament, you might recall when we talked about the hip bone, there was a line called pectineal line in the pubis part of the hip bone. There's a ligament attached to that part which is known as pectineal ligament. Okay, so coming back to this, what are the boundaries of this femoral canal? Anterior boundary is formed by the inguinal ligament. Posterior boundary is formed by the pectineal ligament. Medial boundary is formed by the lacunar ligament. And lateral boundary, it is formed by the fascia between intermediate, mediate and medial compartments of femoral sheath and femoral vein as well. And what is the content? Okay, now coming to the content part. What is the content of the femoral canal? The content is, lymph node of Clockwood. We have discussed it earlier as well. Lymph node of Clockwood. And where does it drain? Okay, so what is the drainage? Okay, so we have studied about this upper end. This lymph node of Clockwood drains the pelvic area. Okay, pelvic region. And the lower end of this. Okay, now see, this is the femoral canal. This is the opening part. See, this is the opening which is open, and this is known as the femoral ring. And now it descends downwards and it is fused. Okay, it is fused, it is closed. Okay, closed by the loose connective tissue near the saphenous opening. You remember saphenous opening, huh? From where the opening, the great saphenous vein drains into the femoral vein. So near the saphenous opening, this femoral canal gets closed with the help of loose connective tissue. Okay, so we are done with this femoral sheath and femoral canal. Now we are heading to the clinical correlation, which is the femoral hernia. It is quite different from the inguinal hernia because inguinal hernia has a greater surface area through which the intestinal components are going to protrude, but in case of femoral hernia, the opening is quite narrow. Femoral hernia. Okay. So femoral hernia is a protrusion of abdominal. It's a clinical condition. Let me give you the definition. It's a clinical condition in which the intestinal contents protrudes into the femoral canal, via the femoral ring, Okay, see, These are the intestinal contents, and this is the femoral canal. See, this is the femoral canal, and these intestinal components get protruded through the femoral canal. Okay, see, now basically a hernia has these parts. Okay, it has a sac, which is a blind sac, and it has a narrow neck. And in case of femoral hernia, this neck is narrow due to the presence of femoral ring. This femoral ring is quite hard, okay, quite stiff, quite rigid, due to which it is more strangulated than the inguinal hernia. So what is the main cause of strangulation? The main cause of strangulation is rigidity of the femoral ring. As well as, and there is another cause which causes the strangulation of the femoral hernia. It is that the femoral ring through which the intestinal contents get protruded out is quite narrower. Narrow femoral ring. Okay. Now it has surgical methods of treatment, like the surgeon will incise the femoral ring, lacunar ligament part of the femoral ring, and see, wait, let me show you. This was the femoral ring, okay, and this part is your lacunar ligament. Through this, the intestinal contents get protruded out. The surgeon will now incise this part so that they can easily pull this out, okay? So that they can easily pull this out. So what is the surgical treatment? Incision of the lacunar ligament, resulting in widening of the femoral ring. The narrow femoral ring now gets widened up, and this femoral hernia is treated. Resulting in widening of femoral ring. Okay, now there is another thing which you should remember. It is that why there is femoral hernia more in females than males. Okay, it is because the females has a wider pelvis, so the intestinal contents have more potency to move towards the pelvis. Okay, wider pelvis. Then in females there are large femoral ring. The femoral ring is more widened. Okay, in males it is like this, or in females it is like this. Okay. So it is seen more in females than, because it has females have wider pelvis, large femoral ring, and also females have smaller inguinal canal. Because they don't have the spermatic cord. Smaller inguinal canal. These are the three reasons for which the femoral hernia is seen more in females than males. In the next video, we are going to learn about the adductor canal, It's quite an interesting topic. So we are all done and dusted with the femoral sheath, femoral canal, and their clinical correlation. Hope you like it. If you like it, please do like and subscribe my channel. Thanks for watching. Bye bye.